Hi, my name is Dave Goldschlag. I'm a prostate cancer survivor, and this is my story. It started about a year ago. I got married to my beautiful wife, my soulmate Gail. She told me she needed to keep me around a little bit longer, and I needed to get a checkup. It's been a couple of years since my last physical, but I wasn't worried about it. I went to see my doctor, I had my blood taken, and I got a telephone call the very next day. He told me that my PSA levels were a little bit higher than he liked. I made an appointment with a urologist. He did a biopsy, and that came back positive for prostate cancer.
So I met Dave a few months ago, just after he came in with an elevated PSA and was recently diagnosed with prostate cancer.
Getting the big C, that's scary. Scariest thing I've ever dealt with. I was a volunteer firefighter and EMT. I was a combat medic for 8 years in the United States Army, and I was a photojournalist for over 30. But this scared me.
The type of radiation that we have here, I was there to help him figure out, the next steps and what type of treatment options he has. PSA is a prostate-specific antigen. It's a type of non-invasive screening test for prostate cancer. It's simply a blood test. It's been around for a long time and has shown high fidelity in picking up prostate cancer. Dave's PSA was higher than we'd like it to be for someone of his age. So that prompted some investigative studies. Fortunately for him, his PSA was detected at a low level. So his cancer was an early stage prostate cancer that had not spread and was very curable.
When I walked through the doors at the Health First Cancer Institute in Titusville, it was a new experience. The staff was friendly and there was a positivity that I had felt.
So picking up a cancer at a lower PSA is an earlier stage cancer and leads to higher cure rates and also can prevent deaths from prostate cancer. So with early stage prostate cancer, we have a number of different treatment options. Active surveillance is just to keep a close eye on that PSA because we have a very accurate marker to keep track of that cancer. In terms of treatment options for early stage prostate cancer, we have primary surgical options or different types of radiation.
I went through a month and a half of radiation. It was difficult, but I was able to get through it. I was able to work the whole time. But while going through treatment, I found out there was an opening at Health First for a visual storyteller. I decided to apply for the job. I finished my treatments and I was offered a position here at Health First. I left my career as a photojournalist and now I'm working at Health First as a visual storyteller.
It was really nice to get to know Dave during this process because prostate cancer can be a pretty long course. So you build that relationship, with your providers. But sometimes, PSA and men's health can be overlooked. Things that you can do to improve your overall health and preventative health care, and one of the things is, certainly early screening and detection.
It's been a tough year. It's been a tough couple of years. My yearly physical saved my life. An early diagnosis of prostate cancer gave me a treatment plan that I am confident in. At the end of the day, your physical is not just for yourself, but also for the ones you love.